You are listening to The Dish on Health IT, brought to you by Point of Care Partners, a leading health IT consultancy. Each episode will feature a rotating panel of senior consultants and guests who will talk about trends and innovations in health IT, while also highlighting how organizations can leverage these advances to solve their business problems. Today's episode focuses on price transparency. Senior Health Information Technology consultants Gary Austin and guest co-host Pooja Babbrah welcome guest Carm Huntress, CEO of RxRevu. Today's discussion focuses on the complexity of price in healthcare, early evidence that prescribers with accurate eligibility and formulary data make more cost-effective treatment choices, and the strides the industry must make to get to real transparency. We hope you enjoyed today's episode and that you'll share your topic ideas with us by emailing us at podcast@pocp.com.
Well, good day, everybody, and welcome to the ongoing adventures of The Dish on Health IT. I'm your host, Gary Austin, affectionately known as Lumpy, coming to you from the beautiful Finger Lakes region of upstate New York. We at Point of Care Partners are health IT consultants with 100-plus associates in over 35 states. We work across all stakeholder groups: payers, healthcare delivery entities, pharma, health IT vendors, and government agencies. And we're viewed as an independent, trusted party, the Switzerland of health consultancy. With me on The Dish on Health IT this week is my guest co-host, Pooja Babbrah, from the sun capital of the country down in Phoenix. And joining us today from Denver is Carm Huntress, the CEO of RxRevu. In this episode, we're going to discuss this cannonball rolling down the hill called price transparency. Pooja, why don't you start us off with a bit of a primer on price transparency for our listeners who may not be that familiar with it?
Sure. Thanks, Gary. I actually love the topic of price transparency. There's so many aspects to this topic. I just never know where to start. But I'll go back to a line that I always use when I talk to people about healthcare who may not be in the industry, and that's it's complicated and unfortunately not very transparent. You and I, if we say to a health plan or a PBM, give us a price of a medication or procedure, we know the first question they're going to ask is what price? It's that complexity that is really snuck into our industry that's just enormous and I think frankly unnecessary. So if you think about the way the world runs today, you go to your doctor, you'll get a prescription, they'll send it to the pharmacy, and you just pick up the prescription. You never really think to say, should I maybe go to a different pharmacy? Are there coupons available for this prescription? We all end up, we go pick up our medication, we pay the price they say that is due, and we walk out. Unfortunately, because the price of medications are going up, you have a lot of patients now that are actually finding out what the price is and just turning around and walking out the door because they can't actually afford their medication. Same thing with, procedures. A doctor is telling me I need knee surgery. I have no idea how much that's going to cost me out of pocket. And it's really difficult to figure out how to find out what exactly that's going to cost for me. So when we think about price transparency, it's all about being transparent to the consumer, how much they're going to be paying for their medications, how much they're going to be paying out of pocket for healthcare, and really kind of opening up the kimono, right? And saying, here's what it's actually going to cost you as the patient to do that. And it's nice to see that we're actually starting to make some progress in a lot of areas around that to make it easier for consumers to find out exactly what they're going to be paying out of pocket.
Very good. Excellent. Thank you so much. Very good primer for the folks who may not be that familiar with it. Now, Carm, let's kind of go over to you for a second. Let's give us a little bit about RxRevu, if you would, just so our listeners know where you're coming from, and some opening comments regarding price transparency.
Yeah,
Carm?
for sure. So we're a Denver-based company. We've been around for now, believe it or not, 7 years. So it's been a pretty long journey. From day one, we've always been focused on price transparency around drugs. We, spent a lot of time in doing a lot of different experiments. Ultimately, we ended up realizing that we had a huge opportunity to really help providers at the point of care in making cost-effective decision-making. And really today, the information they have is nascent or not at all. In terms of understanding what that patient's going to pay when they reach that pharmacy. We've been slowly growing in the space over the last few years, but now we've started to really see a massive acceleration due to a couple different factors, both from the EHRs and the regulatory environment. And I'm happy to say you may have seen the press just about a month or two ago that we've now have over 100,000 doctors in our network, and we've done over 10 million of these transactions this year alone, even in the current environment. So we've grown dramatically and are really, I think, providing a huge amount of helpful information to providers to make more informed, cost-effective decisions, and then obviously helping now really millions of patients on a monthly basis around affordability issues with their prescription drugs.
Got it. Very good. Excellent. Thank you so much. So I thought we'd start off kind of in the news, right? Is this recent CMS ruling requiring hospitals and payers to post their charges online? It was litigated, and CMS won a couple of weeks back now, I think it is. So 2021, here we come with price transparency, right? So tell us a bit about what all this means to the consumer. Carm, let's start with you, and then Pooja, maybe some additional color after that.
Yeah, great question. I think I get to sort of the big idea, which is directionally right. We're doing the right thing in terms of driving consumer-driven healthcare in the right way, and that transparency is a core component to that. And as we look at other parts of our life where before I buy something, I know the cost. There really isn't another industry like healthcare where you don't know that. And so when I look at this regulation, I say directionally right, where a hospital should just have a list price of what they're going to potentially charge a patient if they just came in and bought the procedure. I think the problem, and again, this is where regulatory doesn't necessarily align with the real world, is that there's so much complexity in that, and that you're directionally maybe right, but the real challenge is that negotiated rates are really affecting what a patient actually will pay. And so I think we've got a long way to go to sort of get to that more real time. I'm going in for a procedure or something, and I actually know specifically on my plan with my insurance what I'm going to pay as under a negotiated rate. But overall, I would say this is great and directionally something that we need to be doing and driving forward to advance the industry around transparency. Pooja, you want to add anything?
Yeah, and I think I agree with Carm, right? It's directionally in the right direction, right? And I think we see that a lot from regulation, that the point is, hospitals, payers, PBMs, we're not doing this on their own. So all of a sudden we have regulation, right, saying you have to do this. Of course, there's going to be questions. How do we do it? We're not ready to do this, all of that, but at least we're taking that first step. We talk a lot about interoperability on this podcast, and the same thing, right? I mean, it's baby steps. And I do think that it was an important kind of step forward. There's a list of 300 items that they have to actually, give pricing on, limited the list. But now the question is, how easy is it going to be for them to do that? And then, when will they actually do it? Kind of given this litigation actually is hopefully over now. We'll see what happens. But yeah, I definitely agree. It's in the right direction. And we started out on the prescription side. Now I think we need to start bringing that on the medical side as well.
I've been calling this the revenge of the charge master, right?
Yeah, exactly.
After all these decades of the horrible charge master stories, right? So Carm, it sounds like it's a good thing for consumers to know both pharmacy and medical price info at the point of service, right? So what about the physician? I thought you had a great line. We were chatting a bit beforehand, just getting to know each other a little, and you said something along the lines of the physician's pen is the most expensive medical instrument known to humanity, right? I thought that was a great line. Will availability of this information really change physicians' prescribing and referral habits, and do you have any data to support this notion?
Yeah. And just to be clear, Atul Gawande actually gets credit for that quote. His is a little bit more fine than mine.
Of course, yes.
But he was the one who originally said that. But, I think this was, for us as a company, this was an evolution. We early on actually did spend some time working, going direct to consumer as a business. And I think a lot of startups come into healthcare thinking that. Ultimately, we made the recognition that providers are really the right stewards in so many ways of this information. I think the thing that you have to be careful about, and we sort of talk about this when we go into a hospital, is like, look, we get it that we don't want doctors to be personal shoppers, right? There's limits to sort of what you want a doctor to be able to do, but directionally, you've got the right thing happening where you're thoughtfully putting this type of information into workflow, helping the doctor make a more informed decision and being able to see the cost information of what the patient will pay at their preferred pharmacy, lower cost therapeutic alternatives, is the drug covered, is there a prior authorization, and so all those right things are there. And again, I think from a physician viewpoint, the drug's not going to work if the patient doesn't take it and it can't afford it. And I think that's the number of things we get back subjectively from doctors about the benefit of having that conversation with the patient, and the level of patient satisfaction dramatically increasing is obvious. Our early studies in this, and again, we've only had this at scale for almost a year now. Most people out there are around that time frame, maybe a year to 2 years. So it's still early in terms of evidence. Our early data shows that about 1 of every 5 times the doctor gets presented with this information, they make a change, whether that means avoiding a prior auth, a lower cost therapeutic alternative, moving from a non-covered to covered drug. And in all those cases, you're either doing 2 things. You're either, changing the cost dynamic for the patient and the payer, where their copay is going down, and, you're talking from single dollars of savings all the way up to thousands of dollars of savings to the patient and the plan for sure. And then, you're seeing administrative overhead and labor cost savings to the provider, which is huge, right? In terms of, I don't have to deal with a prior auth. I'm not getting a pharmacy callback. And all those things are really driving much better outcomes. So we've got really great early evidence that this is directionally right. I would also say we are in like version, beta 1.0, right? A lot of this stuff was hobbled together and gotten into market, and it's going to be a constant refinement and iteration. There's still so much, right? A simple thing would be like plan pay. We don't know plan pay isn't available yet. From most PBMs, if not all of them. And that's something doctors ask for. I want to know especially if I'm in an ACO or capitated model, I really want to know the total cost. So there's a long way to go from where we are today, but good early evidence is what we've seen so far.
Got it. Have you involved any sort of credible research type of firm like a Harvard Business School or somebody like that to independently assess some of this data?
It's funny you bring that up. That's just starting. We've got a consortium of about 5 health systems now that have some relationships with some of the leading academic medical centers or institutions like Harvard that are starting to do real studies around this and the effect. I think we're finally to the point where it's kind of, this is now in the e-prescribing workflows. It's running at decent scales at most places. The doctors have, some of the early bumpy pieces have been figured out. And so I think now we're at a place where real studies can kind of go, and they can have control groups and, really do this in the right way in terms of a full blown study. And we're participating in that stuff. We're very interested in it. It's obviously, we're betting a lot on it in terms of the ROI we can provide both consumers and the payers and PBMs that we work with. But we're pretty sure it's there. It's just how much and where are the points of value, whether it's cost savings or, really time savings for the providers and their staff.
Got it. And of course, you've got the Buffaloes out there, so who needs Harvard, right? So we'll look for UC to take and do the studies for you.
Yeah, exactly. So sometimes, I've learned a lot of stuff in healthcare, and I'll tell you, being scrappy and just figuring stuff out is sometimes the best route in so many cases. And I can wholeheartedly say we would have not gotten to where we are today unless we were pretty scrappy and probably working with the Buffaloes out here figuring this stuff out.
Very good. Tell me, it seems that prescription price transparency is moving along faster than medical procedure price transparency. Is that a fair assumption, fair observation on my part? And if so, why? Is it just simpler data, or that industry is a little more electronic, or what do you think's driving that?
Well, so there's a couple reasons I look at. I think one is the need for this in pharmacy has been, I think, driven a little bit harder, and has been around a long time. For those historians, the original spec for real-time benefit check, or real-time pharmacy benefit, RTPB, was originally written, I think, in '06. It's been around a long time, and it was kind of just left on the shelf. And so there's obviously, I think, the longevity here of this idea and getting it to market. I think that there was the claim system, and ultimately the engines that we talk to, and in terms of getting this data out, are a little less complex in some ways than sort of doing this on the medical side. I will tell you, we've spent a lot of time looking at medical specialty drugs, and pricing that drug is incredibly hard. And it's a whole host of things. Site of care matters, and the plan complexity matters, and there's just a lot more factors that you have to sort of take into account to say, for this specialty injectable drug, what exactly is that patient going to pay? Getting to that answer is it's another level of complexity, in our opinion. And I think the PBMs and the systems behind the PBMs were more ready to do real-time benefit, and that's why it kind of came to market and matured a little bit faster. I don't know, Pooja, if you have anything you'd add there, but that's kind of always been my perspective of why this has been winning over the medical side of the house.
Yeah, no, I totally agree. And if you think about it, with NCPDP, so actually the first transactions that were out in the market kind of took the NCPDP transactions, which were, doing processing of claims and kind of turning that into, well, let's send back the price to the provider, right? Or sending a script and sending the price back to the provider. So I think the fact that, we had existing, well-used, well-adopted standards made a huge difference, because people kind of took those and tweaked them a little bit and said, let's do this around real time. I think the other thing you have, though, is, for a long time, we've had the formulary and benefit file, which, static file coming from the PBMs, but it did directionally give the physician, what's on formulary, what are alternatives. Some very few PBMs would send price information and that, but, the doctors were used to getting that information. So it was, again, a kind of an easy transition for the PBMs. And a lot of them, I think, recognize too that by sending a real-time message to the physician, there were other things that they could communicate to the doctor. And, Carm, you brought up prior authorization, right? Like, if a doctor's seeing 20 messages on his screen, a lot of times he just ignores those. But if he's going to price a medication, all of a sudden it shows up that this is going to need a prior auth. That does make the doctor rethink, right? And say, maybe I should be looking for alternatives. And I think that also, that kind of real-time messaging is a kind of an aspect of real-time benefit check that gets overlooked, but I think is really important to the PBMs and payers as well.
Yeah, Pooja, what's going to be the tipping point for this across the industry here? So we're seeing it more and more on the pharma side, little bit of a run starting on the medical side here, and that'll certainly accelerate as we go, through 2021 with the CMS push, right? But is there some event or something that's going to be a tipping point as we look out a year?
Yeah, well, I think, to Carm's point, I mean, just look at the growth of their company, right? Like from the PBM to the physician standpoint, I think we're honestly almost there. 1/1/21 is the deadline for any plan that has a Medicare Advantage plan to have this kind of tool available, right, to physicians. Anything Medicare does, commercial payers follow, because it doesn't make sense for them to be coding for, something for Medicare and not for the commercial plans. So I think, from that standpoint, we're there. I think the follow on to that is, the consumer side. So yeah, the doctor is looking up, he's figuring out what the lowest cost is. But to Carm's point earlier, they can't be price shopping for the consumer. So now you bring in that second piece of the consumer facing, which I think is going to follow the physician facing of saying, now I can actually shop around for this. So I think that's kind of the, I think we're going to be at a tipping point with the physicians by, by mid next year. I think, it's out there. It's just a matter of educating the physicians that, turn it on, start using it. And then with the consumer starting to roll out, and then I think quickly followed by that is going to be the medical side, especially just based on the regulations.
Got it. Okay, good. Gives us sort of a timeline profile in terms of how things will go. Carm, your company RxRevu, it's grown like gangbusters in the past year, like 100-fold or something like that, as we were talking. And by the way, thanks for those options you sent over. I really appreciate it.
Hey, for anyone,
I didn't
for
get
good
any.
podcast, there's a lot I'll do.
My wife wants a patio, and that'll be perfect. So, but that's crazy growth, right? I mean, and I've been involved in some startups where we've seen real significant jumps and like that and stuff. What are you guys doing better, faster, cheaper than the next guy out there trying to drive price transparency, or is there sort of a leading pack at 2 or 3 or 4, and then a big gap to the rest of the field type of thing?
Yeah, I mean, I'd probably say 2 or 3 things here. I mean, the first is just focus. I think, this is the like kind of the one thing we do, and we do it really well. And so, that's a big deal. I've got 40 people heads down. All they do all day is care about bringing price transparency to providers at the point of care. We really haven't done much more than that. I mean, we've done it at massive scale now. But that focus is so singular inside the company. And I think that makes a huge difference. If you look at, other vendors in the space, they're doing all sorts of other stuff and have been historically. And so I think there's a focus piece here that's really important. I think anecdotally through our EHR partners and others, we would say we've got the highest performance in terms of success rates in the mid to high 90s. You have to do a lot of nuanced work. I could sit here, we could talk about quantity unit of measure and NDC repacks, and we could go on and on about the nuanced work you have to do to precisely.
And I think our listeners thank you tremendously for not doing that.
As far as I go. But those are just quick examples of really hard work with clinicians, on staff with us that work on fine-tuning these transactions to make sure they go through cleanly, and we give that the best experience we can for providers. I think the thing we never want is the provider to click on a button or see a blank screen, right? We always want to make sure that transaction goes through, and we care really deeply about that. So focus. I think 2 is that we're a startup, right? We don't have any legacy businesses. There's no bureaucracy really in our organization. We're very lightweight, and we can move very quickly. And we're venture backed, and so we've got a real mission in delivering more value through better prescribing decisions for healthcare, and it's a clear path forward. So having that startup mentality and having speed and agility is a big deal for us. And then really the third thing is our ownership. We have taken venture money, but we do have a half a dozen health systems like UC Health in Colorado that are major investors in us. And that's really enabled us to have a much more intimate and close relationship with the providers at the point of care. And I think that's enabled us to uncover things others maybe would not, about the experience, about how the physicians are utilizing this data at the point of care that allows us to move a little bit faster and identify the bottlenecks. And I think you might have heard of our last weekend, we announced, UPMC is a major partner with us, and that's a huge thing. They're a top 10 system, 3 million person health plan, one of the best in the industry, especially in the pharmacy side. And so I think those are really the core 2 or 3 things that have enabled us to excel in the industry and scale at the level we have, and really make strong relationships with EHRs, because at the end of the day, they trust us to deliver for their clients, which are the providers and health systems that own us. And so there's really a great, synergy there that we're, I think, highlighting as we continue to grow at the rapid pace that we are.
How come one of the big consumer comparative industries, digital companies like an Amazon or Expedia or Yelp or somebody like that. How come they haven't gone after this space, or have they and just not and failed at it, or whatnot?
Yeah, it's a great question. I think, right, this is kind of a little bit of my personal viewpoint in that, the venture dollars here, and we're talking, billions. I don't know. I don't really keep track of the exact number, maybe over the last decade, probably north of $10 billion, if, has been invested in digital healthcare. And we're really not seeing good outcomes. Sort of the same sort of reimagination or transformation of other industries. And so I always get back to sort of why. And I think the challenge is really this over reliance that the consumer is the answer, and that the consumer is the last place here. And I think for an Amazon and others, right, going direct to consumer makes a lot of sense. They acquired PillPack, and they're going to continue to have a heavy focus on consumers, obviously using PillPack for their pharmacy fulfillment. But healthcare is just not that way. In terms of consumer is the, sort of the answer to solve here. Consumers just don't look at that, and the employer complexity and the plan complexity, again, sort of getting services and consuming healthcare is very different. And so I think that's the miss, right? In that, and we really take that to heart. We care. I think Pooja said it right. We're in an evolution to get to the consumer, but you have to start with the provider at the point of care. And there, as I said, right, the pen is the most expensive medical device, because the provider's really controlling and directing that care. They do referrals, they decide on the prescription decision, they decide on the lab, the imaging, the radiology, right? All these things are really controlled by that provider. And I think we've had an over reliance and an over too much of a focus on those companies that historically have a consumer focus. And I think that's why we haven't seen sort of the dramatic transformation for the amount of dollars that have really been invested in the space. And that's why Amazon and others just haven't gotten there in terms of massive scale and massive transformation.
Interesting. Yeah, I keep watching them, thinking, short of PillPack, I guess. Like at some point, like, are they going to do something here? But they seem to just be nipping around the edges on, we'll do some employee clinics, we'll do some pharmacy fulfillment, but not kind of going after the meat of the problem here. It seems to be very startup based. Yeah,
I think they're, knowing Bezos, he's experimenting. I think he's experimenting and learning a lot right now. That's how I look at his strategy. He's got a bunch of different entities doing a bunch of different things, and now the group between J.P. Morgan and Warren Buffett that they've established, and sort of looking at that angle, and they'll find their way. I really was interesting. I think I saw PillPack just established a relationship with Horizon Blue Cross Blue Shield to do fulfillment. That's an interesting move. Horizon doesn't have a great mail order fulfillment component there, and I think that's a good relationship for PillPack. But I think we'll see more and more of that innovation, and 10 years from now, we might be saying something different. But that's kind of the healthcare arc, right? We've got to have a lot of patience in this space. I will say, I really do wish, as a guy who spent a lot of time, I think there's a lot of stigma around working at the point of care and working with providers and in EHRs, and that it's like this, yes, there are harder dimensions of it, but in terms of value and moving the value curve, that's where I would focus. I don't think there's enough companies in this space. I look at the consumer side that's just littered with hundreds, if not thousands, of the next app, right? Where we really should be thinking about how we can better improve physicians' decision making. And I think that the stigma that's so true is like, physicians hate technology. No, they hate bad technology. There's a big difference. And what they've gotten historically is really bad technology. Every time else you've given technology to any industry, what's happened? Complete transformation, huge efficiency gains, cost reductions. What has really happened with EHRs? The exact opposite, right? And so, yeah, we've digitalized things. We've We've done some good with the EHRs for sure, but we're a long way away from the transformations you'd expect there. And so I think there's huge opportunities that are completely untapped today that, I'd love to see more focus from the greater startup community in really driving that influence in how to improve prescribing decisions or other types of medical decisions for sure.
Good, interesting stuff. So how, if you had a payer CEO sitting in front of you, okay, and you had 5 minutes, right? You're at a meet and greet or a dinner or something like that. What would you tell her point blank about price transparency? And don't feel the need to be a kinder, gentler price transparency guru. I mean,
yeah, don't
5 minutes.
Don't sell too much. Yeah,
Somebody's running a blue. What would you say?
Yeah, I mean, this is the number one thing you can do. If you think about moving the dial, right? Would you rather influence one consumer, one of your members, or would you rather influence one doctor? I'd much rather influence a single doctor to change their behavior and their habits, because that's what's driving the dollar and driving a dollar at scale, because that single doctor has 2,000 of your members. And so bringing transparency is one of the first and most effective things you can do to help them understand that there's lower cost options. And I think the idea of you've got ACOs out there, you have value-based models, coupling these ideas together is a huge lever for you, right? You're sitting here say, doctor, hey, I want you to do a full capitated value-based model with me. But guess what? I'm going to give you no data that would help you actually deliver on that value-based contract. Okay, that does not make sense to me. And so transparency is the answer of guiding these decisions. I really look at a future, and I hope this is the future where, we have tools that help the doctor do the diagnostics, right? Of sort of like, what the condition the patient has. But the computer really should be saying, hey, here's probably the best drug or set of drug options. And the reason for that is just pure complexity. There's just no way a doctor in a 7-minute visit could sort that out for an average patient. And we should be really driving at that world of allowing technology to support and, we talk about it as like informed autonomy. It's like you still want to give the power to the doctor to make the decision, but you want that to be a high level of information and a narrow set of options, and let the computer get it there. And then some of the subjective and social determinants of health stuff, let the doctor figure out that stuff and be the more empathetic partner to the patient. And so if I was talking to a health plan CEO, that's the story. It's like, look, you got this network, you spend all this time doing network contracts and figuring out, what you're going to pay your doctors, and you're trying to get them into ACOs and you want to move all the risk onto them. I get that. But what have you given them to really deliver? And transparency is, there's other things you can do, but it's a key component to success there. And that's why you should be, hammering your PBM to deliver on this data, making sure it's in every EHR and every workflow, and making sure providers are using it effectively to make more cost-effective decisions.
Pooja, what gets us there first next year? Pharmacy price transparency or medical price transparency? Where are the big gains going to be made?
Well, I think Carm said it exactly right. The big impact is when you have physicians in these value-based care contracts. And what's interesting is we're starting with pharmacy side, honestly, from the technology standpoint, which, when you think about it, the pharmacy is not really involved with these value-based contracts necessarily. I mean, we're starting to see some progress on that, but it really should be the medical side, right? Of doctors wanting to know they're managing this population of patients. How much is it really costing me to do all the things that I want to do for this patient? So I think, industry-wise, we're going to see pharmacy first, just for the reasons I talked about earlier. Transactions are there, folks are connected. We already have, things in the marketplace. But really, to get us where we want to be, which is, weaving this whole value-based care, and that's really where the impact, besides the consumer, of course, and what they pay out of pocket, but, it really needs to be the medical side and the payers stepping up to say, we are going to get in these contracts. We need to provide those tools, or these tools, to the physician in order to help them understand what the costs are around these treatments. So,
can I ask you both to come back a year from now and let's go back and look at sort of your prognostications and see where we're at and see where the industry is going to change, because I suspect COVID's going to have some impact, right, as we go along, and certainly the pervasive telehealth, the advent of pervasive telehealth will have some impact as we go along, and probably some new entrants and stuff like that. So, Carm, I'll let you take us out on this edition here. So what's the tipping point for price transparency? A federal rule, a Amazon getting in the game, a United and Optum kind of, taking over a market with it? What's going to make everybody stand up and take notice?
I wish I could black and white this one, but it's healthcare. And I think the answer is going to be a little bit of everything. We've got to drive the regulatory side, and as Pooja talked about, the Part D mandate's a great thing. We've got to, better engage the EHRs about the value of having this for their clients who are providers to make better decisions. We've got to really measure the value of this, and then get out there and really talk about it, of what the difference and how we're actually, we can measure and show that we're bending the cost curve, and that this should be ubiquitous. And then lastly, really tying this together into value-based models, and all those things I think are going to leading to a tipping point. I'm incredibly happy of our progress and breaking the 100,000 mark in terms of our prescribers, but there are 1.3 million in the U.S. So our company's not stopping and isn't going to rest until we feel that level of maturity and saturation in the market, that every doctor has this, and because they deserve it. And, we fundamentally believe this is just a core component of healthcare, and we're on a mission to deliver that at scale. And I really look forward to the opportunity coming back a year from now, and hopefully some of these things we talked about have come true.
Great. Excellent. Very good. Well, thank you both so very much for joining us on this very, very warm August day for, I think, all of us, actually, and stuff. So that's our time for this edition of The Dish on Health IT. Many thanks to my guest co-host, Pooja Babbrah, and thanks to Carm Huntress for his insight into price transparency. We'll be back in a bit with the next edition. Please subscribe to us at whatever podcast carrier you use, Apple, Google, or whatever. If you have any speaker thoughts, or if you have comments or suggestions on this podcast, please email us at podcast@pocp.com. Good day for now, and remember, Health IT is a dish best served hot. Good day, everyone.
Thank you for listening. If your organization needs help understanding the industry changes around medication management, or how price transparency regulations may impact you, contact us at info@pocp.com.